Diagnosis and classification of schizophrenia. Schizophrenia is a serious mental disorder experienced by about 1% of the world population. It is more commonly diagnosed in men, city dwellers, and lower socioeconomic groups. The symptoms of schizophrenia can interfere severely with everyday tasks, so that many people with schizophrenia end up homeless or hospitalized. Diagnosis and classification ale interlinked. According to the medical approach, in order to diagnose a specific disorder, we need to distinguish one disorder from another. We do this by identifying clusters of symptoms that occur together and classifying this as one disorder. Diagnosis is then possible by identifying symptoms and deciding what disorder a person has, e.g. OCD, schizophrenia, etc. The two major systems for the classification of mental disorder are the World Health Organization's International Classification of Disease, ICD-10. Version 11 has been published but won't be used for diagnosis until 2022, and the American Psychiatric Association's Diagnostic and Statistical Manual Edition 5, DSM-5. These differ slightly in their classification of schizophrenia. For example, in the DSM-5 system, one of the so-called positive symptoms must be present for diagnosis, whereas two or more negative symptoms are sufficient under ICD. Previous editions of ICD and DSM recognized subtypes of schizophrenia, e.g. paranoid schizophrenia involved mainly powerful hallucinations and delusions. Both DSM-5 and ICD-10 have dropped subtypes because they tended to be inconsistent. E.g., someone with a diagnosis of paranoid schizophrenia would not necessarily show the same symptoms a few years later. Positive symptoms. Positive symptoms of schizophrenia are additional experiences beyond those of ordinary existence. They include hallucinations and delusions. Hallucinations, these are unusual sensory experiences. Some hallucinations are related to events in the environment, whereas others bear no relationship to what the senses are picking up from the environment. For example, voices heard either talking to or commenting on a person, often criticizing them. Hallucinations can be experienced in relation to any sense. The person may, for example, see distorted facial expressions, or occasionally people or animals that are not there, delusions. Also known as paranoia, delusions are irrational beliefs. These can take a range of forms. Common delusions involve being an important historical, political, or religious figure, such as Jesus or Napoleon. Delusions also commonly involve being persecuted, perhaps by government or aliens, or of having superpowers. Another class of delusions concerns the body. A person may believe that they are under external control. Delusions can make a person behave in ways that make sense to them, but seem bizarre to others. Negative symptoms. Negative symptoms of schizophrenia involve the loss of usual abilities and experiences. Examples include speech poverty and avolition. Speech poverty schizophrenia is characterized by changes in patterns of speech. Speech poverty is seen as a negative symptom because the emphasis is on reduction in the amount and quality of speech in schizophrenia. This is sometimes accompanied by a delay in the person's verbal responses during conversation. Nowadays, however, more emphasis is placed on speech disorganization in which speech becomes incoherent or the speaker changes topic mid-sentence. This is classified in DSM-5 as a positive symptom of schizophrenia, whilst speech poverty remains a negative symptom. Avolition. Sometimes called apathy, this can be described as finding it difficult to begin, of keep up with goal-directed activity, actions performed in order to achieve a result. People with schizophrenia often have sharply reduced motivation to carry out a range of activities. Andreasen, 1982, identified 3 signs of avolition: poor hygiene and grooming, lack of persistence in work or education, and lack of energy. Issues in diagnosis and classification, good reliability. One strength of the diagnosis of schizophrenia is its reliability. Reliability means consistency. A psychiatric diagnosis is said to be reliable when different diagnosing clinicians reach the same diagnosis for the same individual, inter-rater reliability, and when the same clinician reaches the same diagnosis for the same individual on 2 occasions. Test-retest reliability. Prior to DSM-5, reliability for schizophrenia diagnosis was low, but this has now improved. Flavia Osorio et al. 2019 report excellent reliability for the diagnosis of schizophrenia in 180 individuals using the DSM-5. Pairs of interviewers achieved inter-rater reliability of +.97 and test-retest reliability of +.92. This means that we can be reasonably sure that the diagnosis of schizophrenia is consistently applied. Low validity. One limitation of the diagnosis of schizophrenia is its validity. In general, validity concerns whether we assess what we are trying to assess. One way to assess validity of a psychiatric diagnosis is criterion validity. Elie Chenot et al. 2009 had two psychiatrists independently assess the same 100 clients using ICD-10 and DSM-4 criteria and found that 68 were diagnosed with schizophrenia under the ICD system and 39 under DSM. This suggests that schizophrenia is either over or underdiagnosed according to the diagnostic system. Either way, this suggests that criterion validity is low. Counterpoint. In the Osorio et al. Study reported above, there was excellent agreement between clinicians when they used two measures to diagnose schizophrenia, both derived from the DSM system. This means that the criterion validity for diagnosing schizophrenia is actually good, provided it takes place within a single diagnostic system. Comorbidity. Another limitation of schizophrenia diagnosis is its comorbidity with other conditions. If conditions occur together a lot of the time, then this calls into question the validity of their diagnosis and classification because they might actually be a single condition. Schizophrenia is commonly diagnosed with other conditions. For example, one review found that about half of those diagnosed with schizophrenia also had a diagnosis of depression or substance abuse. See research by Buckley et al. On the right. This is a problem for classification because it means schizophrenia may not exist as a distinct condition and is a problem for diagnosis, as at least some people diagnosed with schizophrenia may have unusual cases of conditions like depression. Gender bias in diagnosis. A further limitation of schizophrenia diagnosis is the existence of gender bias. Since the 1980s, men have been diagnosed with schizophrenia more commonly than women, a ratio of 1.41, Fisher and Buchanan 2017. One possible explanation for this is that women are less vulnerable than men, perhaps because of genetic factors. However, it seems more likely that women are underdiagnosed because they have closer relationships and hence get support. Cotton et al. 2009. This leads to women with schizophrenia often functioning better than men. This underdiagnosis is a gender bias and means women may not therefore be receiving treatment and services that might benefit them.